Today we're bringing you a slightly different episode. We sat down with Ashely from Sailing Papillon to discuss medical issues on a boat.
You like my towel system I shoved in there?
It works. I mean, keeps the rain out.
Okay. Yeah. Keeps the bugs out. Little gnats and stuff.
Okay.
Yeah.
Courtney, can you lean this way if you're going to lean?
Get closer to the phallic microphone.
Okay. So,
It's just like, could you make this any more awkward for us? Like,
I'm just gonna make this awkward. So.
Okay. Let's go ahead and get started. Courtney, do you want
Who are you, Courtney?
to introduce Ashely?
Yeah, introduce me.
how do I I don't know how to introduce people. Okay, so this is Ashely of
Vanna
Sailing.
White, like.
Yeah. Sailing Papillon.
Hi.
And she has a very similar story. And we would like to kind of share like insights and experience on that. What it's like to live on a boat with medical issues or a set of medical issues,
yeah.
and how to handle them. So,
Yeah. Not so fun. Not the same as having a nice home that you could just drive up to
yeah.
your front door and get in and everything's easy breezy. Living on a boat is a lot more complicated.
Ashely, do you want to talk about your procedure from whenever?
2019, I open myomectomy. It similar to what Courtney's gonna have done, but hers is a little bit more intense because it's a hysterectomy. So mine was, I had a bunch of I guess polyp type things. For females out there, they're called fibroids, and they're non-cancerous forms on the uterus. So those things were causing me a lot of pain, a lot of issues, and you basically had to get them cut out. My surgeon, I asked specifically, take vivid photos of those because I want to see those suckers. And she did, which was great. So I have a keepsake, so to speak. Anyway, it was intense. It's basically having the baby without a baby. Essentially, for me, for you, you're just going to
Everything's going to be cut
everything,
out.
yeah. But they leave your
Ovaries.
Ovaries.
So I won't
So
go into
that's-
menopause, which
yeah.
would be great, but
Mm-hmm.
yeah, it's a whole adjustment after that. Like,
It's intense.
yeah.
And my option was to take medication or a, what do they call it? Birth control. That was a progesterone only. So the thing with fibroids and possibly also what's caused you issues was fibroids grow with blood flow and what's the other thing that they grow on? Estrogen.
Yeah, that's the problem with estrogen. So your body produces amount of estrogen and it just spikes, which means also during your cycle or having a pregnancy, it also causes the spike and then they develop faster. The way my doctor put it was they act like a parasite.
Yeah, oh,
and
lovely.
they just develop and they multiply and they just like, yeah.
They could be like the size of a grain of sand, or they could grow to what Courtney and I both have, or had and about to not have.
Yeah.
Like this large?
About
Would
a
you say?
grapefruit or bigger.
Yeah.
Yeah.
Yeah, so it's amazing what our body can hold within, and you don't know until it's too late.
Yeah, you bend over and you're like, wow, I can't, that's felt weird. Like, I can't bend over like this anymore. I thought my back was just really tight and my pants didn't start to fit. And I was like, well, I mean, tried to change my diet. Like, I didn't know what was going on, but I noticed that I just lost my flexibility and like,
So
you
your
just
boat
don't
yoga
think.
every day was harder and harder?
yeah, getting out of the boat was like, why can't I do this?
Yeah.
So it just creeps up on you and then it's like, no, I need to go to the doctor. Something's not right.
I was doing yoga when I first realized what was going on with me. We were doing downward dog and then Sphinx pose. So you're very on your belly. And I went to the doctor shortly thereafter, and yeah, that's how I got figured out what I was going on with me.
Yeah. Surprise.
So, but are you nervous? Like, how are you feeling about it?
I'm not nervous about the procedure, really. I'm just actually no, nervous. I'm more like relieved that they're gonna biopsy everything because they gotta, check that it's cancer or not cancer. So they gotta biopsy everything. But more relieved to just
Be without the shit?
Yeah.
Yeah. It's unless you've been there, you don't know. And I know a lot of viewers out there probably have, and maybe
It's
being able to hear this kind of thing is helpful.
Yeah.
So that's for sure.
It's
And
just, huh?
well, after my surgery, my surgeon came right up to me the same day, I think, because they do that biopsy really quickly. So she was like, to put your mind at ease, it's non-cancerous. So great. Now I can just be on my drugs and be happy.
Yes.
But yeah, honestly, yeah, you're gonna have a lot of relief coming your way. A lot.
Yeah.
I mean, it's gonna be painful a little bit, but you're gonna be super glad you did it. You know, taking care of your body. And her and Josh want to go cruising, so this is really important to health comes first, kind of a thing.
Should always come first. And sometimes you don't know that you have some issue until you're doing something else and you're like,
That's not right.
Yeah.
Yeah, Josh had a shoulder thing, right?
Yeah, so right after, were we engaged or married? Engaged at the time. Yeah, he tore a ligament or some of the cartilage in the joint of one of his shoulders and had to have it re-anchored. And basically,
no
like,
pun intended.
Yeah. Like, so he couldn't move his shoulder for several months, I would think. Like, getting on and off the boat was, you don't think that because it's not your legs that you're not, like, handicapped in a way, but you are, because you need your hands to grab stuff, you need your hands to pick up things, you need your hands to do everything. And, like, when your arm is, like, bandaged to your body because it's healing, like, you can't. And Josh can talk more about that, too. His experience with that, so.
I will.
Yeah, okay.
We'll film that later.
Yeah.
Yeah,
But it's just one of those, if you break a leg, I mean, how do you handle it?
True.
So,
that's true. Very true.
yeah.
Did you already talk about how you recovered from yours?
No.
Talk about recovery then. What's that going to be like?
On the boat,
On the
well, I was very hands-on on the boat, so that was hard. I wasn't able to do nearly as much as I wanted to. And truth be told, I stayed with my mom for like 4 or 5 days before coming back to the boat, because the doctor's like, where do you live? Oh, you live in a boat?
Yeah,
Don't go there.
Exactly.
Immediately.
That's what my doctor was like, what?
And if you're on a boat, that's going to be the same case. If you're in the hospital getting surgery, they're not going to advise you to do that. They'll say get a hotel room, do what you need to do, but probably avoid the boat for a short period of time. But recovering on a boat is, it's more difficult.
Everything is constantly moving around and tiny spaces, and it is just going to be more difficult, so.
But recovery for me wasn't that bad.
Yeah.
Granted, different surgeries, but, you know.
Same area of the body.
Exactly. I was worried that I wasn't going to be too good to go shortly thereafter. I was surprised how well you bounce back.
Well, my doctor told me about 8 to 10 weeks minimum to get back to, like, normal activities and whatnot. She's like, try to walk, and I'm like...
Oh, they have you walking around the hospital,
oh, yeah.
like,
I mean,
immediately.
that's part of your recovery, increasing your blood flow and circulation, everything else. But,
And they won't discharge you until you poop.
oh, for sure, yeah.
That's a thing.
Yeah, that is a thing.
It's a horrible thing, but you don't think about it. Like, you don't know.
Like, even... That's, I think what I'm scared of most about.
Having to poop? What if you can't
having to
poop?
poop afterwards.
Oh my god! I don't think they're allowed to give you anything either. They want you to do it naturally anyway.
Yeah. But, like, I think that's terrifying, because you're literally going to be cut open every direction. You're like, how am I going to poop?
Oh,
Yeah.
Okay. Yeah. So I can say, and Josh, feel free to bleep all this out, but when I went through surgery, they did not plan it well around my cycle, and I got my period shortly after.
Mine's due the time of surgery.
Really?
Yeah. Oh, but I'm having a hysterectomy, so I won't have a period after that.
You shouldn't. I was going to say.
What?
You shouldn't.
No, after that, yeah. But it's going to be, like, during surgery. I'm just going to make a mess everywhere on the table.
Yeah. So that was an interesting thing for me.
Oh, no.
Yeah, I was in the hospital, and I got my period right after the open myomectomy, and that was like, I had to have help. I couldn't even, in the bathroom, I couldn't, like, no.
Oh, no.
Yeah, nurse had to help me do all that. It was.
Well, they stitched you up. I mean, like...
I had staples.
Oh, man. Well, yeah, but the uterus, they
Yes.
sutured it, right?
Yes,
So, yeah.
yes. But my doctor was actually really happy that happened naturally, because I would have had to call and say symptoms and stuff, but I was there in the hospital if anything went wrong. So, yeah. It was awkward, though. It was really awkward.
I think it's going to be awkward anyways. It's like... I don't know. I don't think I've had anybody help me go to the bathroom since I was, like, 1 year old. After that, you kind of got it on your own until you
Josh
don't.
can help you.
So, Sorry, Josh.
That's a thing.
You married me.
Yeah.
Gonna wipe my ass next week?
In sickness and in health, sweetie.
Okay.
Basically, yes. Yes. Yeah, it's a necessary evil.
My twin sister told me it's his job now, so.
Yeah.
She's not wrong.
No, definitely not. Definitely not. But recovery on the boat was, I was just happy to be back.
Yeah.
It's your little bubble of safety.
Yeah.
And you miss it when you're not there and you're on the hospital bed.
I think so. I think I'm gonna give myself a few weeks at my sister's house. That's where I'm recovering. It's at my twin sister's house because it's all one level. Because getting up and downstairs are not gonna happen for a while.
Mm-hmm.
And then I'll move my way back in probably 3 to 4 weeks. I think would be a good amount of time.
Which I'm so grateful for because she's letting me stay on the boat.
She's gonna be living on the boat while I am in the hospital. So
Yeah. Yeah.
because her boat's currently in Mexico.
Yes,
Yeah.
God. Mm. But yes, I'm grateful for Courtney for letting me stay on the boat while she's recovering because our boat, Travis and I, is in Mexico. Sailing Papillon on YouTube. Check it out.
I'll put a link right there.
Thank you.
Awesome.
And then, do you have any final words of encouragement for Courtney or anything?
Words of encouragement.
Well, I mean, like,
All I know is that I was really worried going into mine, and once it was done, it was just such a relief. That's the thing I stress a lot
yeah.
to you, is that despite maybe nerves, you're going to be really grateful to not have the crap that you've been dealing with for so long
Yeah,
anymore.
It's been pretty bad.
No.
I'm looking forward to not having a period anymore.
Well, I'm a little jealous of that.
I was so excited for that. You have no idea. I don't have to plan my vacations or my days around my period. Like, it is unbearable, and Josh will never understand where I'm coming from on this.
No.
But,
No.
like, I'm no longer shark bait.
Well, and my doctor gave me an option too. She said the same thing, open myomectomy, which is what they gave her, 2 options. You can either never have kids naturally, or you can risk having kids naturally and potentially have major issues. Both things women don't want to hear. So,
Yeah.
especially in our 30s. So,
It is something that we're laughing and having, an interesting discussion about now. But it's a sensitive topic.
It's heavy.
It's a pretty heavy thing to have to make that decision, never having kids
and
before.
to make it now.
And to make it a lot earlier than most women have to make that choice. But I was given 2 options too. It's like heavy medication to where you throw your body into menopause, you get osteoporosis because they want to put you on this heavy medication that stops your estrogen production.
Which is what I did.
Yeah, but it causes a lot of other side effects, and
Oh, yes.
they don't do it long term because of how extreme it is and what osteoporosis and everything else that it does to your body. Like, so it would only be a little bit at a time, and then every time you're off of it, the tumors have a risk of coming back.
Which
and
is what I'm dealing with.
Yeah, and so they always will come back. There's no way to stop it unless you just cut out everything. So it's either go through the myomectomy and then risk, if you were to have kids, rupturing your uterus, having miscarriages, birth defects, everything else, because now these tumors are still coming back if they even could get all of them to begin with.
Which they can't.
Yeah, they can't.
They say that they will, or they can, or they'll try to, but literally they can't.
Yeah, I have so many. There was no way to, like, one of them literally is like the entire right side, and it's just engulfed, like the entire right side. I don't even, it's just pushed everything else, and the other 6 that are in there that I know of.
You should pop up that picture that you have up.
Oh my.
Perfect.
MRI
for
scan? Yeah, I mean, it just,
Intense.
it's literally from hip joint to hip joint. It takes up my
You
entire
got good
pelvis.
hips, though.
Oh, my
At
hips
least
are
from what I could
great,
see.
but like,
Sorry. Bringing levity to a serious conversation.
yeah.
Those hips don't lie.
Now's the time to, like, play, what's
Yeah.
your name?
Shakira?
Shakira!
Yeah. Yeah, well,
It'll all be good.
it'll be fine eventually.
But I want to touch back on that topic, though, because the choices that you're given as a woman are not great. And we don't know exactly what's happening, how these things are forming in our bodies, and we're unaware until it's way too late. Even in your normal, like, OBGYN appointment, they do a
Once a
little
year, they
feeling
don't.
on your uterus, and they're like, oh yeah, it feels fine. This isn't something you detect until it is a problem.
But that's also, they won't do any kind of surgery or procedure until there is an issue.
Yeah.
If you don't feel it and it's not causing any, like, bleeding disorders, not causing any pain, cramping, then they're just like, we'll just leave it alone. You can just live with these tumors until you can't.
Yep.
But by the time they get to that point, like, they're just, one's pushing into my kidney. Like, I mean, they're everywhere. And so it's uncomfortable. in a
What
lot
were
of
the
different
options they gave you? Because they gave me robotic as an option.
I wasn't a candidate for that because
Yeah. For the little ones.
No. So I wasn't the laparoscopic one with the robotic arms that they go in. I wasn't a candidate because of where some of the tumors are. They're
Location.
It's all about location, but they don't know if they're benign or cancerous yet.
Yeah.
So to chop them up would actually, if they were cancer, then
Spread it.
it would spread it.
Mm-hmm.
So that just wasn't an option until they biopsy it to make sure. But by that point, hysterectomy will just take care of all of it, hopefully. So
It better.
yeah.
Yeah.
Yeah. So fun stuff.
Yeah.
Everything that guys will never understand, never have to live in, like deal with.
Well, they have to deal with the emotional side of us while we deal with it. But
There was times I like couldn't even go to work. Like I don't ever really call in, but I literally was up all my sick days last year because like I just couldn't get out of bed. I was in so much pain. Like I just couldn't do it.
and I can speak to the other side if there's someone watching that's gone through or is gonna go through or is thinking about weighing their options. Hysterectomy side and myomectomy side is I got instantly put on progesterone only birth control called Slind, and I did that for about 2 years. But that, I mean, as everybody knows, it messes with your hormone levels like crazy. But I didn't like how I felt on it. And I definitely know that cutting off estrogen from your female body is also not a great thing.
No.
Even if your body makes excess, which mine definitely did. It's just a roller coaster, and it's a not natural or fun one. So decisions are made. I mean, the funny thing is in a year or two, I might have to do what you're doing right now.
Yeah, and that's the other thing. Like the final decision for either a myomectomy with all the heavy treatments to go with that, and the myomectomy and all the medication, and because it isn't just like, oh, take some over-counter like pain meds and it'll be fine in 2 weeks. It's like you have to maintain it for years. But the hysterectomy was the best option because for sure, yeah, they won't ever come back. Like they won't come back unless it's cancer and they spread, and that's a whole different thing. But like we'll see where that is next week.
yes. I have a good feeling for you. You're gonna be good.
Final thoughts?
I mean,
Just a good
we
20
didn't
minutes.
choose this.
No, we didn't choose it. It chose
really
us.
fucking sucks. Like I
Yeah.
don't know how else to put that. It's not like we woke up one day and it's like I want problems.
No, and it's expensive too. It's a
Yeah.
costly thing too.
Oh yeah, I mean like
My insurance.
your insurance what?
My insurance got charged. I think it was over $100,000.
Yeah, for
And
this
if
procedure.
you need the picture, I can show it to you. But if I didn't have insurance, I mean, granted, yes, non-insured people do pay less, but even so, like $100,000 just to have something removed for your body, that is basically a major issue. And that was in 2019. So with inflation,
Yeah, I can't even imagine. Like
Wow.
luckily, so far the estimate for my bill, because I'm on my husband's insurance, and it's so much better than insurance I ever ever had as a teacher. That this surgery is gonna be much more affordable. And had I found this issue a year ago, 2 years ago, 5 years ago, I would have never been able to afford it. Like I would have just had to suffer or just not. I don't know, go out of the country. Because
Yes.
out of the country, like it's so much more affordable. It's ridiculous here. $100,000 my hand surgery, because I've had screws in my hand, shattered bones in my left hand. That was like just the anesthesiologist bill was like over $20,000.
that's a big part of it.
And that wasn't the whole hospital bill. It was just like you can see it, right? Like it's crazy. Like medical in the States here. I mean,
And I can speak to that just recently, doing dental work in Mexico.
Yeah.
When I was we were bringing our boat from Costa Rica up to Mexico, 500 nautical miles from Liberia to Chiapas. And I had I mean, this is kind of on the same topic of medical emergencies at sea or on a boat. I had a massive tooth problem, basically a root canal gone bad, or needing a root canal. Anyway.
Probably, yeah.
Yeah, it was the worst pain of my life. And I was taking, I think at one point, 4, 5, 6 Advils every 4 or 5 hours because I didn't have anything else on the boat. Yes, I know it's bad for my liver and all these things, but I did it because otherwise I didn't know what else to do. I was miserable, and we were on passage, and you still had to maintain watches, and a toothache or any female related thing, like
Yeah.
But we got to Mexico and we found some good dentists and stuff, and the price is just insane. So much more affordable as long as you find a reputable person.
What was your bill?
For the root canal, I think it was like $450, $500.
That's amazing. I can't even get a set of tires that cheap.
It's true. It's true. Granted, I was terrified and I didn't speak Spanish, so we had a translator for a part of it come with us and do like real-time translating, which helped. When they weren't available, we used our phones. But
Not a pinch.
it was interesting having your mouth worked on and then being like, wait a minute. You know, it's, yeah.
That is a barrier. Is when you do travel, it's
hard.
cultural and language barriers and whatnot, and you're like,
Yeah.
I don't know anybody, I don't know where to go, I don't know what to do, I don't know how to speak
Yeah,
language. But
it's scary. Or can be.
yeah.
Yeah. But we got through it. And everybody else on the boat was so glad when that was done because I wasn't a bitch anymore.
So, can you grab my EpiPen? That's another thing I want to add.
Where is that?
It's right up there. I have like anaphylaxis to certain things, and I need to have access to epinephrine.
I don't have,
But-
we don't have one of those on board.
So insurance would cover it. Like it went up to $5,000, and I
Seriously?
was like, it's cheaper to just die. I'm sorry.
No.
At that point, somebody else would pay for my funeral. You know, like there was a year I
I-
couldn't even get it because my insurance wouldn't cover it, and then because this is the name brand one, they have
Yeah.
AviQ, which is another one. But like I couldn't afford it, so I couldn't get it, and I was terrified because like bee stings or anything like that, which can happen anywhere.
And this can save your life.
Yeah.
Quite literally.
Well,
Not
I mean,
just
you'll still have to
E-verbs.
go to the doctor, but yeah,
Wow.
in a pinch, like when I travel or go hiking or somewhere else, I always have one on me, and
Mental
another
note.
one.
Yeah.
But that's the first thing I look for when I land somewhere is get medication. Or what I do is I'll get general antibiotics before I travel. So if there is a language barrier, then you have some general antibiotics to treat like an earache, yeast infection or something like that. Just general stuff that is,
Scurvy.
well,
Just kidding.
yeah, there's other stuff for that. But, you know, things like that where you can already have that on hand.
I
and-
know,
And
I
then
know.
worry about the language barrier and where to go after that.
Yeah.
But yeah, this was like one of those life-saving things that you have to have, but it's also ridiculously expensive here.
I mean, yeah, there's a whole topic of getting a medical kit ready for a boat too, and all that's involved.
I mean, I always have a first aid kit. Like I have a little mini one over there I travel with, and I have an actual first aid kit in the head, for splints and everything. Like if you break something, I mean, so
Your surgery's gonna go well.
I hope so.
Mm-hmm.
Yeah. It's in a few days. I think when I first got the diagnosis, like that hit me with a wave of like emotions and whatnot. And now I'm just like, well, I got a couple days. It is what it is, you know. So we'll see how I recover and how much pain I'm going to be in. And
You're gonna just surprise yourself.
Yeah.
Our bodies are resilient. We're
Well-
built for this. We're not built for this, but we're built for pain. Women are.
women, yeah.
Yeah.
But I'd much rather have the hysterectomy now than when I'm 65 and like
Yeah.
can barely walk.
Well,
or
you would.
something.
Maybe you
Like,
wouldn't remember it. You're just, did I have a hysterectomy?
No, I feel like I recover better, much faster at my age now, in my 30s, than when
You'll
I
bounce back much.
much
easier.
much easier than somebody in their 60s. But
True.
um,
Fun anecdote about being 65 with a hysterectomy. Yesterday at the Bridge Club, there was a woman who insisted she had 3.
three
Yeah.
what?
Hysterectomies?
Yeah.
That's not fucking possible.
Yeah. So all of her friends are like, that's not possible. You haven't had 3 hysterectomies. And she's like, I have had 3 hysterectomies. Oh, wait, I mean C-sections.
Yeah. Okay. Completely different.
Wait a minute.
She forgot about the 3 kids she had to have.
Oh my lord. Well,
Wow. Okay.
Well, actually, it was like 5, but yeah.
Yeah, probably.
something else to note for if you're going to go the myomectomy route is the way that they approach your incision determines that you will have to have a baby a C-section only.
Oh, yeah.
Because when they mess with your uterus, you don't get to have a natural birth.
Yeah,
And
because they
that's-
rupture it.
That's something that they told me, and I was like, oh, I don't really care. I heard C-sections are pretty great anyway. But for those who want a natural birth, that's just something to think about.
Yeah, because you'll rupture once you already cut into it. It is possible now. It has been done that you can still have a natural birth after having a C-section. It is
Yeah.
possible for someone, but not for most.
Yeah, they don't take
Um,
the risk. At least
yeah.
I was told, yeah.
No, once you cut into it, it's scar tissue weakens the area. Then like it could, well, yeah. I mean, could rupture it too.
Yes.
So.
Yeah.
I don't know. So, yeah,
It's hot in here now.
it is. Any
We take a break and
Yeah.
turn the AC back on.
Well, thank you so much for watching our latest video. We did more of a podcast style this time instead of a traditional YouTube video, but please let us know in the comments below if you got more information out of the podcast style or you prefer more of the traditional YouTube.
We've got a lot of other exciting content coming your way very soon, so stay tuned and we'll see you again soon.
Don't forget to like and subscribe.